Hey, today, I hope you guys are having a great week. It is Wednesday. Yay! Um, see so much stuff online about passing the National Registry exam, and I get it. Stressful as all hell. Some people tell you, just read the book, you'll be fine. And that's cool, right? Resources are out there, books and study guides and apps and exams, even like my turbomedic.com. All stuff designed to help you study, get your knowledge base going, and not just pass a test, but hopefully be a good provider. But today, I wanted to just focus on some tips to help you specifically with the National Registry exam, okay? Because I think it's important to do that so that you're not going in blind, okay? So let me just go over these real quick. Hopefully, I can bang this out for you guys, and you can take some of these away and run with it. Now, of course, some of these, you might have heard these before. If so, that's great. I'm hoping this is going to kind of be a reinforcement of that, okay? One of the biggest things, guys, is to know your American Heart Association guidelines. Okay, now this is right from National Registry. Okay, they don't always recommend something, right? They're kind of vague on what you should use. They don't recommend textbooks or study guides and like that. But when they tell you to study or a specific thing, I think it's a good idea to take heed and listen to that, right? So it will most likely will test on American Heart Association guidelines for CPR and for cardiovascular care. Okay, so be familiar with current guidelines. All right, just don't throw away questions because you're not knowing the current AHA guidelines, right? And this is something. The next one is something you've probably heard is the pick the best answer, right? Now, keep in mind that the exam is trying to test you and to figure out how you're going to respond while you're providing patient care. Very difficult when you think about it when it comes to doing it for a multiple choice test, right? So when you answer incorrectly, it's probably because there's a misunderstanding, maybe a common mistake, right? Or maybe maybe a wrong approach or inefficient approach to what's going on with the patient that's going to be less than optimal for that scenario, okay? So you're looking for that best answer, right? So each of their questions on the exam, right, the cognitive exam, is going to have 4 potential answers. Now, I go deep into this in the EMS exam success formula that I have, but just to kind of give you just a quickie here, 4 answers. Now, how do you answer them, right, is the best one. How you get there, there's different ways to do that, but what I wanted you to keep in mind for this short video here is that it's possible that all 4 might be right? Or all 4 can even be kind of wrong in a way. So you as a test taker, you've got to choose what is going to be the most correct of the choices that are given you, okay? So if all 4 are right, think which one is most right, okay, the best answer. I'm sure if you've been researching, you've been doing stuff for National Registry, right? You know this already. This is stuff that you've heard before. Guys, I'm trying to hammer it home. I want you to succeed on this test, right? So maybe you've heard these 5 tips before. Maybe I'm kind of giving you a different angle of it. Whatever it is, embrace it and take it to heart, okay, when you're studying and when you're going to take this test, okay? Don't fail. There's no reason for you to fail. You've passed your state exam. You've passed your course, okay? You know the stuff. It's a matter of approaching, I always tell people, it's a matter of approaching the format of the test, not necessarily your knowledge, okay? All right, number 3, look for things in a question that make it critical, okay? Keep an eye out for that, all right? So they give you these scenario questions, right? And it's going to be a critical situation. A lot of times you'll see things like altered mental status, right? They may even be more They might describe it as restlessness, anxiety, unresponsive, right? That's a critical situation you want to look out for, right? Rapid pulses, abnormal skin signs like being cold, cool, and clammy, okay? Sometimes they're going to give you clues that the patient might even be going into shock, all right? So you've got to keep this stuff in mind, guys, all right? Because this is the stuff that's going to indicate that there is a critical situation going on, okay? So use the question for those clues to determine whether or not it's a critical situation, okay? And hopefully they're going to give you enough cold and clammy, altered mental status, stuff like that, that's going to lead you to believe, okay, this is a critical patient. I need to do critical steps when I'm looking at my answers, right? So if you determine that the question is giving you a critical situation for that patient, that means you got to respond in a more timely or urgent type of intervention, okay? And this should help you kind of narrow down those answers, all right, to give you stuff to leave the other answers that are going to have more urgent responses, more urgent intervention, okay? So if they give you this critical situation and then the question is going to say what the next step is, it's unlikely it's going to be apply a splint, right? Because it's a critical situation. All right. So more than likely you're going to want to have to answer it in something like ventilate the patient or administer oxygen, something along those lines, right? Start CPR. Okay. Things like that. Okay. So just keep this stuff in mind. All right. When you're taking this test. Now, the next one, I'm sure you've done this throughout your testing, your EMS career, whatever, but it's important for me to mention it again, guys. Read each question carefully, right? Don't skip through parts of the question. Read the whole thing. Read each answer, not just the one that looks good. Read all four. Don't just answer the first one because it looks like it's the right answer. Like I said before, they might all be right, okay? You want the best one, all right? Take note of words, all right, that might change the meaning of an answer to a question, all right? Things like anterior and posterior can mean a little bit of a difference when you think about it when you're asking for like what percentage of burn is the patient on, right? And think about that too. You're going to want to know what the rule of lines is when you're thinking about that, okay? Other words like never, always, sometimes, they can make a difference and they can trip you up if you are overlooking those questions and not reading through the question on the exam. Take the time to read each question and understand what's being asked of you. Okay, again, guys, I have this in the EMS exam formula. You can go to emsseo.com, okay, and you can check that out there. I believe the actual link is, I'm going to post that down for you guys because I want you to be able to access that if you are interested, because I'm telling you, just knowing the knowledge, everybody knows the knowledge. That's the best part. You're not going to struggle most likely with knowing what's going on, right? You've passed your test already. What you're going to struggle with is how the questions are presented, how to answer questions, how to look at questions, right? So go to emsseo.com/formula, and you can read all about the exam success formula there. I'm going to put it in the notes here, all right? So you can check that out. But again, it's emsseo.com/formula. All right, guys, real quick, the last one, airway. Now, I'm sure you've heard this before, but I cannot tell you how many people screw up because they don't recognize an issue with the airway in a scenario. So it's all about the airway, okay? You're going to have, most likely, about 18%, 20% of questions on the National Registry about airway, respirations, and ventilations. About 85% of those are going to be related to older patients. And about 15% or so probably, I'm going to say pediatrics, okay? So check this stuff out, guys. All right, keep this in mind. All right, because you're talking about 80% of the questions, right? That's information that they're giving. This is on the National Registry website. So they're giving you this information. Don't squander it. Use it as tools. Use it as the knowledge you need to focus on this stuff and not throw away questions about airway, not throw away questions about critical thinking. Okay? Again, this is stuff that you probably know. It's a matter of understanding what the question is asking, how to narrow down answers, how to filter out what's going on in the question. That's what the exam success formula that I have does, all right, if you're interested in that. Now, the reason why we mention airway, because there's a lot of problems around airway ventilation, oxygenation when it comes to EMTs and medics doing that in a pre-hospital setting, okay? I know to this day, when we test on skill stations and stuff like that, they still hammer home the importance of airway ventilation, oxygenation, okay? So the NREMT, when you're doing that test, they want to make sure that all of their emergency medical technicians that they've done have undergone the proper training and that they can go ahead and show proper patient care, okay? Especially with the basics, all right? So, you know, most of the mix-up when you're taking the exam is that you don't really know or you don't really recognize, because of the scenario, the appropriate time to oxygenate versus ventilate, okay? So look for clues, guys. So if the patient's in respiratory failure or has inadequate respirations, right, then ventilation is your priority. Yeah, they're going to need oxygen, right? But oxygen has to be breathed in by some method. If they're not breathing because they have respiratory failure, giving them oxygen is not going to do any good. So keep that in mind, right? So, and also keep in mind that if you're going to ventilate the patient, what else has to happen? The airway's got to be clear, right? Don't throw away questions, all right? Don't just throw them away. These are easy questions. When you really sit down for a second, take a beat and think about it, right? It can be easy. This is stuff you know. It's a matter of recognizing it when you're looking at the questions. All right, so again, let's say you got a patient who's not breathing, right? They're apneic, okay? So what might be an answer for that? You might see an answer that says, well, okay, open the airway, ventilate with a BVM, attach to oxygen at 15 liters a minute, right? At a rate of whatever, 8 to 10, 12 to 10 breaths per minute, right? One ventilation every 5 to 6 seconds, right? So these are keys you got to think about, okay? Because if you don't manage that airway, what happens, right? Harm comes to the patient, worsening conditions for the patient, right? So this is why you got such a percentage of 18, 20, 22% that is focused on airway ventilation and oxygenation, because the NREMT wants to make sure that the people that pass are competent and you're knowledgeable, especially in this area, right? So make sure that you know your training when it comes to airway management, okay, whatever level you're at, EMT or paramedic or whatever, okay? All right, guys, I got a few more tips, but I've already gone about 13 minutes or so here, so I'm not going to keep going on with it. I hope some of this has rung true for you. Again, this is very specific to National Registry and what they're looking at, but at the same time, this is also key information and also very important information for you to know just on a day-to-day basis when you're taking care of patients and when you're taking other exams in the future, okay? Again, guys, want some help with this? Check out the EMS exam success formula. I put a link to that in the notes here on the page here. Go check that out. And I'm telling you, that's something, while it can give you a lot of insight for National Registry, I've designed it, I've created it as a way for you to finally kind of break that sort of wall, okay, in order to succeed on any EMS exam now or in the future. Okay, I'm telling you, for me, EMS has always been a non-stop testing environment. And if I would have done and researched the things that I did to create this formula, and this process, I think I would have had a lot of easier time in my early years as a EMT and paramedic. All right, guys, that's it for me. Please be safe, man. I've been in some messed up situations recently, and listen to that last Facebook video I did about the firefighter who was shot by reviving that OD patient. Man, be safe. All right, there's no joke out there for us, and while we might not be in as many dangerous situations as police on a day-to-day basis, they do occur, okay? And we can get caught off guard, all right? I've been caught off guard. I know many people that have. So don't be caught off guard. Stay safe. Keep your head on the swivel, as they say, although I hate that saying, but it's true. Always maintain your situation awareness. All right, guys, please be safe.